This is Carolina AM.
Welcome back to Carolina AM. It is Medicare Monday, and joining us once again is Tonya Bell of Senior Care Insurance Services. Thank you for joining us once again, and each week making this process seem a lot easier.
Yeah.
And I will tell you, hard to believe, I've got about 40 years until I'll be eligible for Medicare. I think the camera might add some years to that, but luckily talking to you each week, I have learned that this process is so simple when they talk to you, and this process is starting to wind down. So with that, can you still help somebody before December 7th, even if they've already picked a plan?
Yes, we can. We actually, if you've already picked a plan, that's fine. We can actually do a second opinion. We can look at the plan that you chose, compare it to, other options that are out there, and see if there might be something else better. The way it works is the last app in wins. So anything that happens at midnight on December 7th, still counts up until midnight December 7th. So whatever application you put in last is the one's going to start on January 1st.
And ideally, you don't want everybody waiting to the last minute. So make sure you hit that QR code so you know to do that. But,
yes.
And sometimes the way the world is, so you reach 65, you think you're not going to be working anymore. Sometimes you are. You might be on like an employer plan. So what do you say to someone who has that, they want to avoid any penalties?
Yeah, so the biggest thing with employer plans is that if you are on an employer plan and you have an HSA, so you have a high deductible health plan, you're contributing money to an HSA, you cannot take Medicare Part A or B, or you will get a tax liability for taking that and still contributing to an HSA. So that was one of the biggest things. And then the other thing is employer plans have gotten so expensive over the last few years. So sometimes employer plans are more expensive than the Medicare plans or Medicare Advantage and Supplement, either one. And the ability to be able to come off of an employer plan and do that, change that, is just call us. We can tell you all the details, because that's the biggest thing is there's so many details with an employer plan and the options.
And we talked previously many times, you will save them money on their plan.
Yes.
What a great way to do that. So the deadline's coming up. We've chosen our plan. We are set. We're ready to rock and roll. That doesn't mean that the conversation's done. Are you guys still available throughout the year, even though the plan is in place?
Yes, we are not like some of those agents that just call you during the annual enrollment period and then are gone, never answer their phone throughout the year. I actually have two staff people that answer the phones all year long, and they're there right now answering the phones while I'm here. And we're there to help. We have a team of agents that help as well. So if I'm not there to answer questions, somebody's there to answer questions and be able to help throughout the year, all year long.
Yeah,
this is all we do.
And I'll say it's another reason why you choose local as opposed to some big box, whatever it happens to be, because you see the person and they know who you are. So that's really important.
Yeah.
And with that, as we are kind of getting towards the end, any final tips, suggestions you would have for someone on what they should be doing?
Yeah, the biggest thing is to make sure that you don't forget anything. I see what happens a lot of times is like, oh, this medicine's in the fridge, or this medicine's over here on the bed, nightstand. I forgot all about it. I didn't put it in there. I didn't tell my person about it. So taking some time, gathering up all those medications, gathering a list of the doctors that you see no matter what, even if it's once a year or once every couple years, because you might see them this coming year. Having that list together and ready is the biggest thing, and then call us.
Yeah, and part of that key too is if you don't know what questions to even ask, you call Tonya. She will give you the questions you should be asking, because you'll be asking them those questions as well.
Right, for sure.
And with that, it does not cost them anything for your services, correct?
No cost at all. No cost at all. We get paid directly from the carrier again, so they can just call us. We can help. No additional cost to them at all. Numbers
right there on the screen, QR code as well. This can be, we've talked about it before, this can be an incredibly difficult process. Only if you're doing it on your own, or you think you can, you've talked to your neighbor and they've given you some tips, and we've learned that is not the way to do this. Please call Tonya and her team, and you'll get them on the right track. So thank you for coming by and informing once again. And please stick around. We've got more Carolina AM coming up after the break.